Intellectual Disabilities Early Intervention Program.
My name is Jim Donmoyer. I am the Executive Director of Lebanon County Commission on Crimes, Lebanon County Commission on Drug and Alcohol Abuse.
So used to saying that.
I was
often,
thinking. Wow.
Well, thank you again for inviting me and my cohorts. This is my 25th year of giving reports. As always, it's been quite a year. What we do is I give my report of the totals, and then I'll turn it over to Holly and Jim, and they can go into more explanations, and then I'd like to give a few comments at the end, not relating to my report. Following report 2019, we had investigated 772 cremations this year. That's up. Last year we had 716. And I'll go into a little bit about the cremations. Natural deaths, we investigated 251 this year. Last year it was 208, so quite a rise there. We had 41 accidental deaths. And the breakdown of that would be 28 drug-related deaths, which Jim will go into shortly. We had 12 motor vehicle accidents, and we had 1 drowning. Then suicides, we had 19 compared to last year. We had 22, so we saw a decrease there. And gunshots continue to be the main method of death. And Holly will go into the breakdown of the rest. We have investigated 1 homicide. Last year we had 3. We had this year 7 undetermined deaths. And what that means is after autopsy, the pathologist could not come up with a conclusion of what the manner of death was. And we have 1 pending, and last year we had 1 pending at this time. So as you can see, it was quite a year. Just to give the public, and I go over this every year, cremations, everybody who gets cremated in Lebanon County is investigated by the coroner's office before cremation occurs. And then we issue our report. So I'll turn it over to Holly, and she can go into more detail on the breakdown of the suicide.
Sure. So, as Dr. Yocum said, for 2019, there were a total of 19. It was down from the previous year for 2018, so that was a good sign. We're very pleased with that. The average age of the individuals was 48.8 years. That is down slightly from the previous year, which was 50.1, but remains pretty consistent throughout the years. There were 15 males and 4 females, and again, that was pretty consistent with last year's statistics. Last year, we had 4 females as well, and all others being male, so that's also consistent. As far as the method, by far there were, by firearm, 12. There were 3 that were by hanging. 1 was by pills and alcohol. 1 fluid inhalation. 1 was hit by the train. And then 1 by stabbing. And those were self-inflicted, unfortunately. As far as veteran status, there were 4 veterans included in the completed suicides. Last year we had 5 veterans, so that again is pretty consistent. This year we had 5 that were from out of county, and so the remaining were county residents. As far as their history, whether they had a known mental health history, only 5 of the individuals were known to have a mental health history, and then 3 of the individuals were known to have a drug and alcohol history. And then there were 16 individuals that were Caucasian. 1 was Hispanic, 1 Asian, and 1 was Black. So if we do a summary of the completed suicides, our primary population most at risk for suicide continues to be white males, middle-aged or older, who die by firearm. Oftentimes isolated and not connected to the service system, or really connected to the community very well. So our task force has ongoing efforts to address the suicide to do suicide prevention and awareness. We continue to have an ongoing media campaign that is in partnership with Wellspan Philhaven. We have ongoing trainings, so they're training specific to suicide prevention, one being QPRs, question, persuade, refer, suicide prevention training, and then also mental health first aid trainings, which really help for awareness and our community being able to help individuals who may be at risk. And then this year, we're working on a new initiative for young adults to train youth in QPR. So really believing that youth training youth will have a much greater effect on our youth and our community, and essentially creating ambassadors within their schools and their communities to really help their peers with any difficulties that they may be having. Then we continue to discuss other methods that we might be able to reach our at-risk population. So there's a lot happening with the task force as well. And then, hopefully we'll be having September Suicide Prevention Month. So we're currently looking at planning those events and what will be happening during September as well.
Okay. As Dr. Yocum indicated, this past year, 2019, we had 28 overdose deaths. In comparison to 2018, we had 27. And going back as far as 2017, we had 27. So the number this year is pretty consistent with the previous 2 years. The breakdown of the 28 individuals, the average age this year was 44.9 years of age, which is higher than normal. Normally we see the highest age group, or the most people fit into the age group of 30 to 39. This year that average age was higher than expected. We had an individual as old as 79 years of age, and our youngest individual was 22 years of age. The breakdown, 20 males, 8 females, 19 Caucasians, 8 Hispanic, and 1 unknown. It's worth pointing out, as we always do here, that out of the 28 confirmed overdose deaths, 22 involved opiates, mainly fentanyl. The 6 other overdose deaths were non-opiate related. This year I also broke down for you by zip code where these are occurring in Lebanon County. In the 17046 zip code, there was 13 overdose deaths. In the 17042, there was 6. In 17033, which is Anvil, was 3. 17067, there was 3, is Myerstown. 17087, 1, Palmyra. And 17038, 1, Jonestown. And there was 1 that occurred in 17545, which is not Lebanon County, that occurred in Manheim. When I say it occurred in Manheim, the person lived in Manheim but died in Lebanon County. So out of the 28 people on my list, 27 were county residents and 1 was an out-of-county resident. The age breakdown, again, I found that interesting. I broke that down as well. We had 6 individuals that were in their 20s. We had 30 individuals we had 5 individuals in their 30s. We had 5 in their 40s. We had 7 in their 50s. We had 4 in their 60s, and we had that 1 individual in their 70s. So to me, it's indicating that no one under the age of 22, no adolescents, all adults, but the age of these folks are getting older and older. And that is a concern for the elderly community and so forth. So again, we used to be dealing with the male Caucasian, 30 to 39 years of age, opiate user, and the age right now is starting to rise.
Just let everybody know, as I have these cases, Jim and Holly get to know immediately of all these demographics that they give, so they can direct their resources to where they need to direct them to. So here again, I can't compliment any more the relationship that we have. Being able to call each other anytime, anywhere. It's just a pleasure working with them. A couple things. to let the county know, the citizens know that we have secured a transport vehicle. It's the first time in Lebanon County history that the coroner's office has secured a vehicle, which should be coming into service soon.
That's a good description.
Yeah, soon. Not sure exactly the date yet, and that's because of the transformation that took place with the first aid and safety patrol, and a lot of the areas that they don't service anymore. So we've secured that vehicle. I have 3 new deputies that have come on board, 2 right now, 1 coming. So 2 of them are from the first aid and safety patrol. They expressed interest, so we brought them on board. So we'll see some new faces, but all the other faces have been pretty much the same through my tenure.
And you'll also be able to utilize some of the, some hazmat technicians on a casual call basis. So
Right.
what we've discovered is that maybe once or twice a month, there's an occasion where there just hasn't been a transport available at all.
Right.
So in this case, between the vehicle and some casual call hourly employees for DES, that'll give the coroner's office enough, always
Right.
have resources.
Right.
Can you name the deputy sheriffs, or the deputy coroners, rather?
Vicki Ham is one, or it's Vicki Beck. She was Vicki Ham, Vicki Beck. And I think you all would know Tom Capello. He's brought on board. Then the other one hasn't completed the course. I'm not going to say the name until he completes the course. And the Good Samaritan Hospital, to let the public know, is going to be expanding their morgue in the future here, and to allow more access for the hospitals, deceased patients, and the coroner's office. So we're working with them on that. And again, my thanks to the commissioners for cooperating with the coroner's office and getting done what we need to get done.
Thank you, Jeff.
Thank you, sir. And Molly and Jim, thank you.
Very good. Thank you.